adductor magnus, adductor longus and brevis, pectineus, ASIS, sartorius, rectus femoris, iliac crest, gluteus medius, tensor fasciae latae, IT band, greater trochanter, trochanteric bursa,
On top of the greater trochanter.
sacral crest, PSIS, gluteus maximus, ischial tuberosity, sciatic nerve, hamstring muscle group.
Okay, now we're going to active range of motion. So lay on your back. Bring your toes up to your face. Perfect. Back down. Do it again. Perfect. That is supposed to be 120 to 130 degrees. Flip over for extension. Bring your heel up. Do the other side. Perfect. Back down. Okay, do it again. Beautiful. This is supposed to be 10 to 20 degrees. So now we're going to do abduction. So bring your leg out as far as you can. Okay. Do it again. Beautiful. This is supposed to be 45 degrees. Adduction, bring your leg out this way. Okay, move this leg as far in as body can. Okay. Again. Beautiful. This is supposed to be 30 degrees. So now we're going to do internal rotation. So sit on the edge. Internal rotation, so rotate this leg out. Perfect. Again. Beautiful. Now do internal or external. Beautiful. Do it again. Beautiful. Okay. Oh, now we're going to, internal is supposed to be 45, external is supposed to be 50 degrees. Lay on your back. We're moving the passive range of motion. So I'm just going to take your leg here, bring it up. This is supposed to be firm and feel due to the hamstrings. Now I'm going to do it bent. This is supposed to be soft due to the quads. Extension, flip over. Take it, bring it up, beautiful. That's supposed to be a firm end feel due to the anterior ligament lesion. Bent, same thing, up. That is again supposed to be firm due to the anterior ligament lesion. So now we're going to do abduction, lay on your side. Leg straight. And I'm just going to bring it up. Beautiful, that's firm due to the medial capsule and ligament tension. So now we flip over. For adduction, bring this foot over crossed, have it flat, just like that. And then I'm going to bring this up. Beautiful, that's for, should be firm end feel due to the lateral capsule and IT band tension. Lay on your back, internal rotation. Up, rotate. This should be firm due to posterior capsule tension, and then external rotation, rotate. That should be firm due to the anterior capsule ligament tension. So now we're going to do a manual muscle test. So flexion, press up. Beautiful. This tests the rectus femoris. Bent leg, so you're going to sit and have your knees off. You're going to sit, have your knees off. And then push up. Beautiful. This is just for the iliopsoas group. So extension, lay on your stomach. Push up. Beautiful. This is for the hamstrings with the straight leg, bent leg. Push up. Beautiful. That is just for the gluteus maximus. So now we're going to do abduction. So lay on your side. Leg straight. Push up. Beautiful. That's the gluteus medius and minimus. And then this foot and put it flat right there. Push up. Beautiful. That's adductor group, pectineus and gracilis. Now we're going to do internal and external rotation. So you're going to sit right here. So internal, you're going to push out, push, beautiful. Internal or external, push in, beautiful. Internal is for the adductor group, hamstrings, and glutes, and external is for biceps femoris and gluteus maximus. So now we're going to move to the test. So we're back, or side, I mean. Straight legs. And then this is the iliac crest compression. So you're just going to press down on the iliac crest. This is positive if there's pain, and that means there's a posterior SI ligament sprain. So now we're going to do an anterior distraction. So lay back. Push out. This is also positive if it's pain, and that means an anterior SI sprain. So now we're going to do the fulcrum test. Sit up with your legs off. Put a forearm underneath here, and push down. This is positive if there's pain, and that means there's a possible stress fracture to the fibular neck. Hip scouring. You bent here. You're going to push down, internally and externally rotate. This is positive if there's pain, and that means there's a possible labral tear. Patrick's test, bring your ankle up here for figure 4. And then you're going to push down. This is positive if the thigh stays elevated or there's pain in the SI joint, and that means possibly for iliopsoas spasms. Gainslands, you're going to lay down or lay on your side. You're going to bend your leg, bend both. Okay, while this one's flexed, just bring it back. That is positive if there's pain, and it'd be the SI joint or L4 lesion. Ober's test, flip on the other side and almost on the edge of this. Straighten your legs. Okay, you're going to abduct and extend the hip and drop. And this would be positive if, okay, you can relax. That'd be positive if it stayed above the table, and that would be tightness in the IT band. Thomas Kendall's on your back. You're going to pull both knees up. You're going to let one drop. Relax. Oh, you slide up to the end of the table. Do it again. Okay, let one drop. Okay, for Thomas, this is positive because his thigh doesn't make contact with the table. That's a tight iliopsoas group. And then for Kendall, his knee is flexed. It'd be positive if it was extended. And that would be the tight rectus femoris. So now we're going to do piriformis. Lay on your side. Yeah, I guess that's better. Bend this one. Just let it sit there. And then I'm going to stay like there. Push down on this knee. And then that would be positive if there's tightness or pain, and that'd be piriformis syndrome or entrapment of the sciatic nerve. There are Trendelenburgs, so stand up. Like that. Get down eye level with the iliac crests, and then you're going to stand on one leg. You're going to see if the iliac crest drops, stay on the other. They don't drop. So to be positive, they would drop, and that would be a weak gluteus medius. So now we're going to do the femoral nerve traction. So lay on your side, bend your knee, just like that. And then I'm going to extend, just like that. Maybe positive if there's pain. going back, and it would be an impingement of the L2, 3, and 4. Now we're going to do a hamstring tendon reflex. So lay on your stomach. You're going to put your thumb. You're going to hit your thumb. If it's bilateral, or if it's positive, it'd be the L5 and S1, which would be the medial hamstring. The S1 and S2 would be the lateral hamstring. If it's bilateral, it'd be upper motor lesion. If it's unilateral, then it would be lower motor lesion. So now we're going to do the dermatomes. Flip on your back. The S1 goes up here, starts high, goes anterior, and that is for hip flexion. S2 is a little lower, does the same thing, hip flexion. S3, that is for knee extension. L4 comes down across and attaches inside the foot. That is for ankle dorsiflexion. L5 does the same thing, comes down and is in the webbing of the toes. That is great toe extension. S1 comes down the side, attaches in the foot right there. That is ankle plantar flexion. And then S2 is in the back, goes down behind the knee, the Achilles, underneath the heel, and inserts on the foot. And that is for knee flexion. So now we'll do the reflexes. Patellar, relax. The patellar is for L2, L3, L4, and L5, and the Achilles, that is for S1 and S2.